Cervical cancer is a growth of cells that begins in the cervix. The cervix is the lower part of the uterus that links to the vagina. Different strains of the human papillomavirus, also called HPV, play a function in causing most cervical cancers. HPV is a common infection that's passed through sexual contact. When exposed to HPV, the body's immune system typically prevents the virus from doing harm. In a small percentage of people, however, the virus survives for years. This contributes to the process that causes some cervical cells to become cancerous cells. At the initial stage, cervical cancer might not cause symptoms. As it grows, cervical cancer might cause signs and symptoms such as bleeding from the vagina after intercourse, between periods, or after menopause, menstrual bleeding that is heavier and took longer than usual, watery, bloody vaginal discharge that may be heavy and have a foul smell, pelvic pain or pain during intercourse. There are two major types of cervical cancer: squamous cell carcinomas and adenocarcinomas. About 80% to 90% of cervical cancers are squamous cell carcinomas, while 10% to 20% are adenocarcinomas. How cervical cancer can be diagnosed. Regular gynecological screenings with a pap test can detect most cases of cervical cancer. A pap test, or pap smear, is a test that collects cells from your cervix, and HPV test. Cervical cancer develops slowly and over many years. Before turning to cancer, the cells in your cervix go through a lot of changes. The once normal cells in your cervix start to appear irregular or abnormal. These abnormal cells may go away, stay the same, or turn into cancerous cells. What is cervical cancer pain like? Pain becomes severe as cancer progresses and spreads to nearby tissues and organs. You may feel pain in your pelvis or have difficulty urinating. Other people will feel generally unwell, tired, or poor appetite. What is cervical cancer pain like? Pain from cervical cancer may not feel like much in the early stages of the disease if you feel anything at all. As cancer progresses and spreads to nearby tissues and organs, what are the stages of cervical cancer? Stage 2. Cancer has spread beyond your cervix and uterus, but hasn't yet spread to your pelvic wall, the tissues that line the part of the body between your hips or your vagina. Stage 3. Cancer has spread to the lower part of your vagina and may have spread to your pelvic wall, ureter's tubes that carry urine, and nearby lymph nodes. Stage 4. Cancer has spread to your bladder, rectum, or other parts of the body like your bones or lungs. Risk of developing cervical cancer can be reduced by having cervical screening tests and receiving a HPV vaccine that protects against HPV infection. Well, it only protects against 2 HPV strains, which means it's a limited protection, and that's why it's advisable to prevent unprotected sex and be with just your partner. Stage I. Cancer is found only in your cervix. It hasn't spread and is small.